President Trump is pushing for a House health care vote this week, and he's doubling down on the pre-existing conditions claim. Here, his latest tweet. Quote, health care plan is on its way. We'll have much lower premiums and deductibles while at the same time taking care of pre-existing conditions. But the newest version, it doesn't guarantee that coverage for those pre-existing issues. It also allows states to opt out of a coverage that and even charge those folks even more money. Now, that is one of the many things that could keep the cost down, but the question is, at what cost to millions of people who enjoy that benefit now? You will remember Speaker Ryan couldn't even get a bill to the floor previously, and he canceled votes not once but twice. Back then, the Conservative Freedom Caucus wouldn't support the bill. This time around, they've signed on for the most part, but the question is, do they have enough votes to pass this, especially with moderates having some uneasy issues? And no Democrats apparently are voting yes for it. So the Trump administration says, though, trust us, this time we have the numbers. Let's bring in our panel right now. Jeanne Zaino is a professor of political science at Iona College, also senior advisor at the consulting firm Applied Techonomics. Dominic Carter, political journalist and author, and Andrew Whitman, our senior political correspondent. I'll start with you, Andrew. Math question. I hear the bluster, and I've heard some of the sound bites from some administration folks. They think they're there, Gary Cohn being one of them. Is the math there? Are the numbers there? Do they support the plan as written?
Not just yet. There's still, I think there's 20 or 21 Republicans who are on record talking with reporters saying that there's not enough in this new proposal for them to sign off on it. As you know, 22 is the magic number. If the Republicans lose 22 votes, they can't get anything passed without Democratic help. And there's about 10 to 15 members of Congress who have not really indicated one way or another which way they're going to go.
And the real issue, the hang-up for folks, and we use the term moderate, but it's a relative term, I grant you, but they're worried that the public says, okay, well, pre-existing conditions are this. But you read the fine print, or not so fine print in this case, they kick the can down to the states. States don't have the revenues or the monies to pay for this, to do the coverages, and they withdraw it. The concern is, well, who's going to get blamed for it? This is really just, you know, kick the can or pass the buck, whatever analogy you want to use.
And that may provide some cover for Republicans who are in more moderate districts in Republican states. Because if you have a Republican governor and a Republican state house, odds are that you can get that cover there. But it's still an issue, and there's not a lot of wiggle room here. There's not a lot of room for Republicans to lose votes on this one. And there's still no deadline for this, and there's still no CBO scoring either, which means we don't know what the total number of people who lose insurance coverage would be. And that's really where the rubber hits the road for these moderate Republicans. If they have to go home to their voters and hear, hey, we're going to lose coverage, or coverage is going to be more expensive, or we're not going to be guaranteed these benefits, then they may very well be no votes.
And you can have governors, Dominic, they're going to be screaming bloody murder. Now, all of a sudden, it's not Uncle Sam who's covering the nut. I got to take it out of my budget here, and I'm bleeding red ink as it is. That's where I think you're going to have people resentment at state capitals across this country where, you know, we always do the analogy, you know, governors can talk tough and say, you know, we're going to, it's a state mandates, you can't raise property tax, do whatever X, but then you're the county exec and you're saying, yo, well, what gives? Where am I supposed to make my money from? So it's, you know, in this particular case, I can even see Republican governors like in Arizona and other states that do have Medicaid expansion, Medicare expansion, that they're going to say, how am I going to do this?
Absolutely, Richard. It seems like the more the pieces of this puzzle is moved around, there's at least one group that's left on the outside screaming bloody murder. There are reports tonight that this deal is falling apart, healthcare deal, amongst Republicans. I don't understand, Richard, why they keep pushing forward with this when the support is not there. And you talk about working the vote in past segments. And you're right, some of this stuff should be behind the scenes before you talk about it publicly. The whip, what's the term, Professor, when they count the vote?
Yeah,
the whip,
head count.
And the head count. And it's like the president just says whatever's on his mind, the votes are not there, and then it falls apart. We've been down this road,
and then we get the blame game. And I talked about it with the congressman before. I know it's a good line, but you can't blame the Democrats for obstruction when you don't need one of them to vote your way. You got the House and the Senate, and as Andrew's shown in previous polls, the public says already, even if they don't change one letter of the existing health care law that we have right now, it's no longer Obamacare, it's Trump care. Fair or not, that's where it is. And certainly when he touches it, that doubles down. I'm with Dominic. After the first fiasco, it's not like they don't have enough things to do. Do they have to do this first to try and pay for the infrastructure or the tax cuts? Or could they really, say, we'll get to this third?
They could say that, but they're not, because let's not forget, they have put themselves in a box. 2012, 2014, 2016, they have run, 2010 even, they have run on the issue of repealing and replacing Obamacare. And they now have themselves in a box where they feel like they can't go before the American public in 2018 or certainly 2020 without having been able to achieve this. So they're trying against all odds to achieve it. But the reality is, healthcare is as fraught with disaster now as it was ever. And Dominic is absolutely right. There are winners and losers when you're talking about healthcare reform. And if you are not honest about who is on the losing end of this, it comes back to haunt you. And that's why they're going to be in trouble. Even if they're able to cobble together this, 22 votes that they need to push this thing through, it is going to be a disaster for them come the midterms. So they have a real quandary on their hands. They have run repeatedly saying they would do this, and it is something they never should have said, because it was easy to say when they were in opposition and not so easy to do when they are in the majority.
Andrew, I think the best scenario for Republicans is they pass it somehow in the House and let it die in the Senate. They'll claim some Pyrrhic victory that they tried, but the obstruction of the Senate and the Democrats. You already heard Trump already saying today, the rules of the Senate. It's impossible to get anything done or whatever. First of all, you knew that when you ran for office, or at least you hope you did. We'll talk about his knowledge of history in a second. But Andrew, to me, Jeanne said it. The only thing worse than not passing it is actually passing it and getting it enacted. The price you will pay politically by next fall for this thing, when people are going to say, what gives? All of a sudden I lost my coverage. I think if Republicans could have their way, because it's never going to get through the Senate the way it is now, they'll get it through the House and they'll die at the Senate, and they won't be able to figure out reconciliation.
I'm not so sure, if only just because if it gets through and it passes and there are negative consequences as a result of it, it's still something of a jump ball. You can try to make the argument that, this is not my fault, or this is the way that this was negotiated, or this is your governor's fault, or whatever the case may be. There are other excuses to be had, whereas considering that every Republican on Capitol Hill and the guy in the White House campaigned, and many of them campaigned in multiple years for repealing and replacing Obamacare, that's such an obvious, in-your-face, easy-to-prove broken promise. And I don't know how well that plays for Republicans with their voters back in their home districts. Obviously, I think if they pass a crappy health care plan and people are negatively impacted by it, that's got a downside too. But it's just, it's such a low-hanging piece of fruit for voters to be able to grade a party or a candidate on.
Well, a key component is the messaging game here. And this may shock you at home, so I want you to sit down for this. But President Trump, he's slamming the media.
What?
And the media, that's right. And the media actually isn't saying such great things about the president in return. The question is, are there any winners here? We'll discuss that after this.